Good morning, everyone. My name is John Nelson. I'm with the communications team here at Nuvance Health, and I am honored to be joined by Dr. Cornelius Ferreira once again today to do a little Facebook Live Q&A about the COVID-19 vaccines. Believe it or not, Dr. Ferreira, this is our 8th one of these that we've done, and it's the final in our series. And while today's topic, we're going to talk a little bit about why it's important for younger folks to get vaccinated. I do also want to just recap a little bit and touch on, the vaccines that are available and, side effects and all kind of the general stuff. But why don't we start with the news, which is there is news out there that next week it's anticipated that the FDA is going to authorize vaccinations for Pfizer for those 12 to 15-year-olds. What do you, welcome, number one, and what do you think about that?
So I'm super excited, right? So, the more people we can vaccinate, the better off we'll be as a country, and the more quickly we can get to herd immunity. And, so even though children are less likely to get severe disease and potentially die from COVID, they still die, right? There are a small number of that age population that gets really sick with COVID. So I am very excited to see this, because the other thing with the younger population is they're also more likely to be asymptomatic and transmit the virus to us older folks. So by getting them vaccinated, we can stop that transmission. We can get the herd, the entire population vaccinated and create more of a herd immunity that will protect everybody in the long run, which then ultimately gets us back to what everybody currently is looking to do, right? Have some summertime, have those barbecues, get out for graduations, and do all of the fun things that we're used to doing.
That's right. And so what do you say to like a parent who may have gotten vaccinated themselves, but are like nervous about their child, getting the vaccination as well? What would you, as a primary care doctor, say to that parent?
Yeah, so the first thing I think is the thing that I would make very clear. So I have a son. He's 16 years of age. So as soon as he was eligible to get the vaccine and we could get access to the vaccine, he got vaccinated. I am a big proponent as a family physician that prevention is better than cure. And I tell people that even though the younger population don't always get as sick, there are still a multitude of things that we see as consequences from COVID-19. There's a condition called multi-system inflammatory syndrome, which basically is a symptom complex identified with COVID, and we don't know everything about it yet. There's a lot of work being done by the CDC, but that's a disease state that causes inflammation in the brain, the eyes, the heart, the kidneys, even the gastrointestinal tract. And those inflammatory changes can lead to a whole slew of bad consequences for children, including strokes and other complications. So when I weigh the benefits of a vaccine that have now been given to millions of people across the world, and when we look at the side effect profile and the number of people that develop complications from that, it is such a small number that I feel confident telling anybody who's listening in today that please go ahead and get those kids vaccinated. We have enough data, we have a lot of research and science that has gone into it, and I am 100% convinced it's safe. Will they have side effects from it? Absolutely. I remember my 16-year-old waking up after his second dose of Pfizer going, "Dad, I have a headache and I feel a little achy." They can see the same side effects that we see in adults. The good news is most of those side effects are short-lived. They're easily treatable with a little Tylenol or ibuprofen, and then those kids just go on their way and they live life to the fullest.
That's great. And as someone who has a 14-year-old, I certainly I feel the same, and I'm looking forward to when it's authorized and he's able to do that. So very exciting stuff. One other piece of news that came out, I think it was yesterday, was the President of the United States, President Joe Biden, said that his goal is to get 70% of the U.S. population vaccinated by July. Why exactly is he shooting for that number? What does that mean? Why is that the goal?
Yeah, so that target it sounds really high, but to get to what we call herd immunity, where the vast majority of folks will have an immunity to COVID-19, you have to strive to hit that percentage. And if we don't get to that percentage, then we're likely to see continued outbreaks and continuation of the infections, because you need everybody in the herd to be safeguarded. so that if there is a little couple of pop-ups for folks that, for whatever reason did not get the vaccine, that mass will actually be protected against it and limit spread of the infection across the United States. So it's a noble goal. I think it's one that we can attain, but we need people to understand that vaccines are safe. It's the right thing to do. And I will tell you, I watched a very cute video on Twitter last night where they were actually talking about getting back to normal. And that video was so telling to me, with grandparents, walking their grandchildren down the street, people going to graduations en masse. So I think everybody's goal would be to get back to that normal, and knowing that we have safe vaccines that really, there's nothing nefarious about them. Nobody's implanting microchips in you. Nobody's putting something in you that's going to cause you harm. It really is to get us safe and get us fighting this pandemic. We've done this for decades with flu vaccinations. We were able to eradicate polio essentially from the globe using vaccinations. I think people have forgotten, when you think about things like polio, people born with limb deformities, paralysis, vaccines really have come a very long way since their inception. And I think if you look at all the data with all the different vaccine types we have today, that we are in a much better place because of them.
And that's a good segue. So, why don't we get back to basics just for a minute, and just remind folks out there, the vaccines that have been authorized for use by the FDA, and what the differences are between them, and why it really doesn't matter. The most important vaccine that you can get for COVID is the one in front of you, and all that stuff. So could you talk a little bit about the vaccines?
Yeah, so the good news is it doesn't matter which vaccine you get. They're all equally efficacious. And what they have shown is that we see a decrease in the number of people that will get hospitalized. And we see that there are 0 deaths in those individuals that have gotten the vaccine. So I think when you hear that number, 0 deaths, that really is an incredible statistic. There's 3 different vaccines that are authorized today. In the pediatric population, Pfizer looks like it's going to be the first to obtain that emergency use authorization for the 12 to 15-year-olds. That is a vaccine that is an mRNA type vaccination, and it's a shot that's given today, and then 3 weeks later you get your booster. Moderna is not authorized for that age group just yet, but I know that they're also in the process of looking to apply for one of those emergency use orders. So that's a vaccination for 18 and over, and again, it's 2 separate vaccinations, 4 weeks apart. And then the third vaccine that's out today, only approved for 18 and over, is also the Johnson & Johnson vaccine. That is an adenovirus-based vaccination. And I know there's been a lot of media, including the recent CDC pause on utilizing the Johnson & Johnson vaccine. That stemmed from side effects in the form of what we call thrombosis, or some blood clots. That was seen in a very small subset, I believe 6 cases out of 7 million doses given, mostly females under the age of 49. So after conducting more review, more research, the CDC and the FDA have both come out and said this vaccine is safe. And the reason for that is when we look at the clotting mechanisms and the thrombosis that occurred, those rates were really no higher than what we see in the general population. So, again, the Johnson & Johnson vaccine is safe, and I think that's the message that needs to be out there.
And I think that, we're at kind of a tipping point right now, right? Because I think that a lot of people have been vaccinated, but there's still a large percentage of our population that is eligible who haven't gotten vaccinated. And we're starting to hear, in news stories and things like that, that supply is starting to exceed demand, where when it first started, people couldn't get appointments, and now there are lots of appointments out there. So, I think my message, and I think you would agree, Dr. Ferreira, is if you want to get vaccinated, go find an appointment. They're out there. They're all over. You can go to your county website. You can go to your state website. You can visit us at newvancehealth.org and search our COVID vaccine FAQs. You can go to vaccinefinder.org. There's all sorts of places for you to get an appointment and to get out there and get vaccinated, because that's the way we fix this. One other thing that comes up a lot is side effects. And, I think it's important that if you could just talk a little bit about those and remind people that, the importance of why they're happening and what that actually means when you get vaccinated.
Yeah. So most vaccinations you can have some sort of side effect, and there's a lot of similarity between different vaccines, including COVID-19. So the most common things that we see or hear is that individuals will experience little dull headaches. They'll feel achy. They may get a low-grade temperature. I know with the Pfizer Moderna vaccines, there are individuals that get a little bit of a higher temperature, 101, 102. And then, some people will get some stomach upset, nausea, sometimes loose stools. So the side effect profile is well known, it's well established, and most of that will resolve within 48 hours with or without any additional treatment. For those folks getting a headache, a little bit of achiness, discomfort, taking a antipyretic, after the vaccine is something that can help to alleviate those symptoms. And I tell people who get those side effects, it's actually a good sign that your immune response is actually very vigilant and is actually reacting to the vaccine, meaning that you're having a good response to the vaccine and it's going to show that there's better immunity. So a lot of reassurance that is anticipated, it's expected, and it just shows that your immune system is vigilant and it's picking up on this virus that has been in viral particles that have been introduced, and your system's going to build up their self-defense mechanism to overcome that.
Well, and it's funny because, I certainly have talked to folks, both my parents were vaccinated. Neither really had any sort of, side effects or, anything at all from both doses. However, like when I got vaccinated, my first dose made my arm a little sore, but that didn't surprise me. But the second dose I got, certainly, I got the chills. I felt, achy and all those other things. So, that didn't scare me though. It made me happy. It made me feel like, oh, this is working. I'd much rather have this than get COVID. So that's a good thing, right?
And and that's I think a crucial point, right? So with the vaccines, because we vaccinated so many millions of people across the world, we have data from the United States, Israel, Europe. So we know a lot about the side effect profiles. The thing that is still unknown and scary to me is that COVID is a relative new disease. We know a lot about it. Our technology, our research has accelerated over the last 14 months as a result of it, but we still don't know what those long-term sequelae or consequences of having COVID is going to be. So, I put my bet to get the vaccine, stay safe, understand what the side effects are going to be from the vaccine, and whatever I can do to prevent myself or somebody that lives with me or that I come into contact with, giving them COVID-19 would certainly be devastating to me. So I want to take every possible step to protect myself and those that I care about.
Absolutely. And, it's kind of like what you said at the beginning of this, which is, the risks and the benefits, like the benefits really outweigh the risks of getting COVID. We've been in the middle of it, within healthcare since the beginning, and we've seen, kind of what this disease can do to people, do to families, due to our communities, and now that our states are starting to reopen and, like you mentioned that video, things are starting to hopefully get back to normal. It's important that we all do our part. So,
yeah. And you look and you see what's happening in India, right? So I think as a country, we're very fortunate that we have as much access as we have today to vaccines. In many other countries around the world, they don't have the same level of access to vaccines. They don't have the same level of access to medical expertise. So you can see how devastating this is in countries like India and Sri Lanka. So that's why, I appeal to everybody listening, go get the vaccine. Let's get that herd immunity up so that we do not end up where we were in March of 2020 with the hospitals being overwhelmed, the health system being overwhelmed, and then having to shut down so many of our businesses that are crucial to our financial well-being.
Well, that's fantastic. So we are going to cut this a little short today because, hey, it's Wednesday. There's a lot going on. So, Dr. Ferreira, thank you so much. Did you have any closing comments before we say goodbye to everyone?
No, I would just say, get the Fauci ouchie, as they call it. It's time to do it. If you're on the fence, talk to the people around you that have done it. And what one patient told me last week was, I did this not so much for myself because I'm scared of vaccines, but I did this for my wife and my child who need me to be around. So I think that's a really appropriate message. If you don't want to do it for yourself, do it for those around you.
Dr. Ferreira, it's always a pleasure. I appreciate you joining us today. You have a wonderful rest of your day. And everyone, thank you. Please go to vaccinefinder.org or to newvancehealth.org or, you visit your county, your state, your Department of Health. Find out where those appointments are. They're at pharmacies, they're at primary care, some are at hospitals, they're at mass vaccination sites. You know, get out there and get vaccinated. Thank you so much. Take care.
Thank you. Bye-bye.
Bye.